So, hello and welcome, everyone. This is Coffee with Qamar. I'm Dr. Qamar Khan. I'm a board certified Yale trained nephrologist practicing in United States. Today, we have in our studio someone who many of you probably already know. We have Dr. Sohail Chugtai, who is an orthopedic surgeon from UK, and he's uh, an author of this book, Telemedicine: A Novel Way to Fight Pandemic. He's helping to revolutionize the field of medicine through his telehealth program powered by Medical City Online. I believe one of the main reason for him being able to deliver this amazing system is that beside him being a physician and orthopedic surgeon, he is also a Microsoft software engineer, and that is why he knows what a doctor and patient needs when it comes to interaction and patient visit. He is the founder of Medical City Online, which also has supported Sehat Kahani, which is another success story. And we hopefully will get the founder of Sehat Kahani in one of our programs down the road. This program of Sehat Kahani has helped uh, delivering online medical uh, healthcare to Pakistan in very very cost effective way. So he has also partnered with Indus Hospital and many other institutions. Recently, he is working on some healthcare project with the government of Pakistan on the request of federal health minister. And we'll talk about all these things in our program. He helped fight COVID last year and even this year in Pakistan, especially in province of Punjab. And this was done through his telehealth program, and one of the main reason that it helped to prevent the spread of COVID was that we were able to provide telehealth to these people who did not go and crowd the um, emergency rooms and doctors' offices, because many of those uh, issues could have been dealt just by talking to a doctor, patient being at home. So he also has recent work for providing free online health services to uh, Pakistan as well as overseas with this new COVID spike, and through Doctor 24/7, which is a very commendable program where we have volunteer doctors and they are providing service with no charge to the patient. So I can go on and on, but I think I have to wrap up, and then I'll present you Dr. Sohail Chugtai, and we'll talk to him and ask him some questions, and let's see what he can tell us about telehealth. I mean, that's his passion. That's my passion also. So Dr. Sohail Chugtai, and welcome, Dr. Sohail Chugtai, to our program.
Thank you, Dr. Qamar. I appreciate you calling me in this show. Thank you.
You're welcome. So tell us about your telehealth system. I mean, you it is not just a video chat. So that's what we want to tell our like audience that what is it actually telehealth, and what how is it making a difference in healthcare or delivery of medicine.
First of all, I think it's a good start to define what telehealth means. Many would know, but I just want to define it the way a clinical telemedicine system to me looks like. When a patient goes to a doctor, it's not that it's just a meeting. It's more than a meeting. So it's not telemedicine is not video chatting. It's more than video chatting, and that's
Right.
how I equate clinical telemedicine. Because when a doctor sees a patient, he or she not only examines the patient, There is a set of review of medical records, then making certain judgments, then also using some tools, and then making some other parameters. For example, doing some minor patient education if required, also giving some preventative medicine advice, and then giving some instructions, or sometimes it may require referral to another doctor. Of course, prescription writing also matters, and then making notes back into the patient's electronic medical records. So all of that interaction is more than video chatting, and that is why I do not support those systems where video chatting is being taken as telemedicine. I think it's an opportunity lost because now the doctors are keen to learn telemedicine, and if we divert them to Skype or video chat or Zooming, and start calling that as telemedicine, we would lose that opportunity to put them on the right track in the first go. So
Right.
I call telemedicine video communication between patient and doctor incorporated seamlessly within a clinical decision support system. That's what I call telemedicine, telehealth. And telemedicine basically is the patient doctor encounter, whereas telehealth is communication between patient and doctor to support healthcare reasons through any channel or any means, whether live or
Right.
asynchronous.
Right. And we have talked about this telehealth, that we want to take the software and the camera and everything out of the picture. We just want patient to feel that he's actually talking to he or she is talking to a doctor. That is, tell us a little bit more about it. That how we have taken this to the next level, especially during COVID. That we have your software and we talk to the patient. We are at the same time like delivering care. I mean, writing prescriptions and all those things are all integrated, I'm assuming, in our healthcare telehealth system.
Yeah, well, I think my work has been focused on simulating or recreating the experience for a patient.
Right.
If patient has gone to a doctor, what is that experience in person, and how can I communicate? How can I relay that experience? Copy that experience virtually. That is what I focused on.
Hmm.
And the advantage I have is that being a clinician for over 30 years now in orthopedic surgery, and being an IT person for the last 20-25 years almost in
Hmm.
medical IT. So I can see where to meet, where
Right.
the overlap is. So I use that overlap to create experience of patient seeing a doctor as if the patient has actually gone to the doctor's clinic. So what we do when the patient goes to a clinic, first of all, the patient will meet a receptionist,
Hmm.
and then the patient goes to a waiting room. Patient enters the doctor's room, greetings exchanged,
Sure.
sits down, history taken, notes examined,
Hmm.
decisions taken with mutual consent,
Sure.
instructions given, and patient goes back. And
Sure.
then there is a follow-up. Then the doctor can start from where the doctor left last time. All of that in the same sequence in my telemedicine systems, I have recreated on
Wonderful.
the, on the click of a button. So it's all visual. For the doctor side, if the doctor follows the sequence of my system,
Hmm.
that is the recreation of the physical appointment. From the patient side, I've got two models. That is, one is a direct telemedicine.
Hmm.
The patient can contact a doctor from home. So that means it's a website which patient has an account on, and the patient will follow a very simplistic, visually guided template to meet the doctor and follow the instructions. And then he or she has a login to go
Sure.
back into the same account
Hmm.
and make further observations like adding a blood pressure reading, adding a temperature reading,
Sure.
copying an X-ray, copying a lab report for the next
Hmm.
visit.
Sure.
That is direct telemedicine. Now, let's say if the patient does not have the intellectual capacity or the logistic support with him or
Hmm.
her,
Hmm.
like there's very little internet bandwidth available to the patient. Patient doesn't have the intellectual capacity to make an account on the internet. But normally that is not the case nowadays because everyone uses app on smartphones.
Right.
So let's say the patient does not have the intellectual or logistic capacity,
Hmm.
then the patient will go to actually a telemedicine facility where
Right.
there is no doctor but a telemedicine assistant, a
Hmm.
coordinator sitting there. with a laptop, with a computer, and then the advantage multiplies because that coordinator will have access to
Mhm.
certain gadgets which make the telemedicine even more advanced. So those gadgets are the ones which will recreate the experience even further. It could be a cardio sound device, like you can hear the
Right.
heart sound, cardio auscultation device. It could be let's say an ultrasound scan. It
Right.
could be an ophthalmoscope. It could be a dermoscope.
Right.
It could be an otoscope.
Right.
So those devices are available at that telemedicine facility.
Sure.
And then that facility will become actually a virtual clinic of that doctor who's
Mhm.
sitting far away, maybe in another country.
Right.
So that is called as assisted telemedicine.
Telemedicine. Right.
Assisted telemedicine. The
Right.
first one was direct, and
Yeah.
this is assisted. So
Right.
that is how I try to recreate a patient doctor experience as physical as possible through virtual setup.
Right. And that is one thing that for sure can take the care to remote villages, remote places where there are like no doctors and no healthcare providers. And I have been, being a physician, I've been practicing telemedicine also in my clinic for some time, especially since COVID, and it has given patients a lot of comfort and advantages. Yes, there are some limitations, but you really see the patient pretty much the same way as you're going through their charts, going through their labs and medicines and everything. So I think that your two models that you're describing, they both have their advantages, and people who don't have any like telephone or smartphones, then they can go to those clinics, and we have talked about those models that we can just provide services to the villages in Pakistan where we have a real problem. So yes, I think that's wonderful. Is there anything else that your telehealth system gives us? You would like to tell the audience that there are many myths when it comes to telehealth and like seeing patients through this system. Uh, are there some things that you want to clarify in this program for our audience? And it is true for both patients as well as physicians. So not every physician is comfortable doing telemedicine, thinking that maybe it is a little too complicated of a process, but it is not. So tell us what we should do to kind of promote this telehealth uh, and make it a standard of care.
Uh, I think this question has many layers, but let me address at least one of them. Uh, Telemedicine requires the same responsibility of a clinician as it would be for in-person appointment. In fact, a good teleconsultation is where a patient does not feel that there was a software involved. The
Yes,
patient should get back the feeling that I saw a doctor. Now, telemedicine would fail if the doctor is not confident in managing the software. And
definitely.
that is the key point. The biggest limitation to telemedicine propagation is not technology, is not patient, is not patient education, is the doctor himself or herself. The reason is that if the doctors are not sparing time to understand how this works, so during a live teleconsultation, they will not be confident to manage the controls. First of all, the telemedicine system has to be very clinically oriented. So it should not change the way you see patients in clinics. That's one thing. And that can be understood by a doctor who's a technologist. The second part is that once that is done, then the doctor should also know the patient's side. That if the
Mhm.
patient has a problem, how to troubleshoot that quickly.
Right.
So that does not require too much of a knowledge, but that could be a basic troubleshooting tips. In
Sure.
London, I do my physical. I've converted my physical practice into a telemedicine practice, teleconsultation practice, due
Mhm.
to the COVID restrictions in the UK, and more than 900 patients have been seen through my software in the last 11 months. Now that would mean that I think almost 10 to 11 or maybe 12% patients are re-examinations. Those re-examinations, if you ask them, I
Hmm.
did ask them, that why didn't you wait for my physical in-person appointment because in UK the clinics are going to be open? They said, well, I think we were very, very satisfied and we felt as if we're seeing you. The reason was that I was able to handle their side as well, if required. So the end of the experience of the consultation was that there was no software. I just met a doctor. Now
Yes.
that particular image, if a doctor is capable to leave at the end of the consultation, telemedicine is a winner.
That is very true. That is very true. And that is why I asked this question, because I feel that if the doctor is comfortable with the telehealth system or software, then it becomes like a win-win situation. And that is what we are aiming, and that is what where we are heading. So it was wonderful listening you and understanding the things that are involved in delivering a uh, telehealth and doing a tele visit. And we would at this time we thank you for joining us, and uh, we'll join again later and discuss maybe more things soon. Thank you.